Working to get more boots on the ground in this pandemic. It is one of the reasons Governor Mike DeWine, for now, suspended a law that requires newly graduated nurses to pass a standardized test to get a license to work. Many of those testing sites are not even open because of the global health crisis. But nurses who finished their coursework can fill a need. I spoke with a woman who graduated 2 weeks ago. You feel that this is kind of a baptism by fire?
I mean, just because of the pandemic itself, I think we're definitely going in at a really crazy time.
But that isn't stopping Tabitha Rudolph. She's one of 200 Ohio graduates from the Hondros College of Nursing who can work now. 90 of them are in the tri-state region.
This is truly testing their ability to make a difference in people's lives.
It most certainly is, and we know that because of places that are much further along in caseload. This is CNN video from a hospital in New York, a state that's home to more than 66,000 confirmed COVID-19 cases and more than 1,200 deaths.
We're fighting for your lives and we're fighting for our own lives. We're trying to keep our head above water and not drown.
They've had struggles with protective gear. They've had to convert wards to accommodate coronavirus patients, and they've had to expand their morgue with refrigerated semi-trailers. It's that bad. You also see stories of medical professionals who've caught COVID-19 and lost their lives. When you're sending graduates into what some have called a medical war zone, does that weigh on you at all?
It does. But anyone that gets into the healthcare profession, whether that's a physician or a nurse or a STNA, they did it because they want to make a difference.
We're here to touch lives, and so getting us out there and getting us on board, I feel, is a great thing.
The Ohio Board of Nursing says there are an estimated 4,000 to 5,000 nursing students who would be eligible to take a licensing exam. By admitting grads to the profession with a temp license that allows them to forego the standardized test, in theory, the profession can reinforce its numbers as the region potentially moves closer to a case surge. Kentucky has a similar edict in place, and St. Elizabeth's told me it would bring new nurses into the fold that way. I'm waiting to hear back from places like UC and Mercy Health.